Welcome to Healing with Heart. Simple ideas for profound healing. These videos are meant for informational purposes only, not intended to diagnose or treat medical conditions. Hey guys, Dr. Martin Hart here. Today I want to talk about a potential source of low-level infections and how to help your body deal with it. So we're going to be talking about your sinuses. Okay? Many of my patients come in, they've had chronic low-level sinus infections for years. We find this on the testing we do. Some of them report it, constant chronic sinus infections. It's a common side effect with CIRS, chronic inflammatory response syndrome, where MARCoNS, which is an antibiotic-resistant staph, will colonize biofilms in the sinuses. A lot of times I see patients with strep, sometimes even E. coli in there, different types of fungus, mold, occasionally even some viruses that are hanging out in the sinuses. And what's happening at that point then is those sinuses then are just a harbinger for low-level infections that can leach into the rest of the body because it drains into the back of the throat, it drains through the lymphatics and the eustachian tubes, and so you're just getting these chronic low-level infections that your immune system always has to deal with. It's a big drain, okay? So now some different sources of these, with MARCoNS, a lot of times it's because your immune system's been ran down, and that happens with Lyme disease too, and it gives them the opportunity to colonize in there, and so that's one thing that happens. In our modern American, not just American, but really Western lifestyles, our sinuses and nose and jaw are shaped slightly different. If you've ever read any Weston A. Price type work, you can know that we've gotten narrower and more crowded, which changes the way oxygen moves through our sinuses. And then we have a lot more mouth breathing, okay? And so when we breathe through our nose, we got good oxygen in there to move out and clear out any infectious or microbes that might be hanging out, and the oxygen will help kill them, okay? So that can be a big factor. Highly mucogenic or mucus-producing diets are a factor. So things like dairy, gluten, wheat, grains, those all produce more mucus, which gives more congestion, more things, area, space for those microbes to colonize in there. So what are some things you can do about it? Really simple, okay? This isn't medical advice for you. It's just educational. So make sure you check in with your medical authority that you want to work with, okay? But if you wanted some ideas, number one is nasal breathing, okay? 2, 3, 4 times a day, stop and take 20 breaths in and out through your nose. Doing that increases the amount of oxygen through those sinuses. Even better if you have an oxygen concentrator at home or some way to get oxygen up in there. Those cannulas that you stick in there, it's going to deliver pure oxygen or close to it, which is going to help kill off some of those microbes. And you deep breathe that in and get it really deep in there. That's going to help us move it out. Now also those deep breaths are going to pump the lymphatics for us, okay? And that's going to help us clear more of that as well. So I highly recommend that. A lot of my patients do well with customized nasal rinses. So maybe looking into a neti pot using variations of small amounts of hydrogen peroxide, nanoparticle silver, saline solution, things like that. Those are options, okay? Or nasal sprays even. So a lot of times I'll mix up a customized nasal spray with nanoparticle silver and a little bit of essential oils. Maybe some basil, marjoram, rosemary, eucalyptus. Those are all very mucolytic. They break down the mucus. They can penetrate biofilms. They're antimicrobial, anti-inflammatory, right? They need to be specific to you. Not every patient's going to tolerate each one of those, and you make sure it's very diluted. But a lot of my patients do really well with that, right? Starting to clear that out. You can also do nebulization. You can nebulize, okay? You have to test and see what works for you on that front, but really nasal breathe that in to get it to clear out. And there's some other more in-depth things that I find helpful. Nasal-specific technique, which is a chiropractic technique to open up the sinuses. I've seen a lot of benefit with that. That's been a fantastic one. So if you haven't tried some of these things and you think you and your medical authority want to give it a go, I think it's a great option. I've seen great results with it. Because otherwise what's happening is you're just getting this low-level infection that hangs out for years, decades even. And your body's always having to revert energy to dealing with that. And that's not what we want. We want it to give you energy to deal with life, right? To enjoy yourself and to live fully, not to be dealing with a chronic sinus infection. If you have some things you've done to help you and your sinuses, I'd love to see them down below so that other people can benefit or discuss. And if you find this useful, please share it. Take care.